Good evening, ma'am.
Good evening, Maithili.
So, shall we start, ma'am?
Yeah, start.
Okay. A very good evening to one and all. I'm Maithili Warrior, a first-year MBBS student from Calicut Medical College. It gives me great pleasure to welcome you all to the Symposium Finals conducted as part of the International UG Medical Conference Medmeet 2.0, organized by College Union 2022 of Calicut Medical College in association with Doctutorials. I'm very pleased to introduce the ever graceful and committed Dr. Ashlata Ma'am, Professor and HOD of Government Medical College, Kozhikode, and the vibrant Dr. Satyadevi K, Professor and HOD, Department of Anatomy at Government Medical College, Thrissur. To academics at the forefront of medical education, thank you, ma'ams, for joining us today and for presiding over as the judges for the event.
Thank you.
Before we begin, I shall just briefly introduce the rules of the event. Each of the four participants are to be allotted 12 minutes for the initial presentation, where they shall elaborate on their topic along with the PPTs. During the event, we'll have a warning message post 10 minutes just to let them know about the time constraints. Following the presentation, there shall be a 3-minute duration where the judges are free to ask questions to the participants, and a warning message shall be issued 2.5 minutes after the question Q&A session starts. With the permission of the judges, we shall start the event.
Okay.
Maybe?
Ready.
So welcoming chess number 1. Chess number 1. Ma'am, is there anything that you would like to say before we start the event?
Myself and Dr. Sadi are very happy to be a part of this event. Such events will increase the interest of students in the subject anatomy. So let us hear the first candidate.
We're just facing a few technical issues, and the first candidate will arrive shortly.
Okay.
It shall be test number 2 that will be starting the presentation. Test number 2, before you begin, I'll just introduce the rules briefly. You will be getting 12 minutes to do your presentation, and I'll be posting a warning signal after 10 minutes is completed. And after that, you'll have the Q&A session for 3 minutes. Are you following that? You may begin.
I'm sorry, ma'am. I hope you can hear me. I cannot hear anything. So please, may I have the permission to join with some other device?
But we can hear you. We can hear you. Harita, can you hear me?
Yes, ma'am.
Ma'am, the audio is not working for me. Please, may I join with another?
If this candidate is not ready, you can call the next candidate. So we can save a lot of time.
All right. Then the next candidate will be called.
Ma'am.
You can give us the chess number when the new candidate comes.
All right, that, ma'am. I'll note that.
Okay. സതി, നിങ്ങളുടെ കോളേജിലെ അഡ്മിഷൻ ഒക്കെ കംപ്ലീറ്റ് ആയോ?
ഇല്ല മാഡം,
എത്ര പേര് വന്നു?
150 160 ആയി തോന്നുന്നു.
ടോട്ടൽ
175 ആണ്. 175 ആണ് ടോട്ടൽ.
175. അതിൽ 160 വന്നു അല്ലേ?
അറൗണ്ട് 160.
ഞങ്ങൾക്ക് 245 ജോയിൻ ചെയ്തു.
അതെ.
ഇനി 5 പേര് കൂടിയേ വരാനുള്ളൂ.
നമുക്ക് 10-15 പേര്.
ക്ലാസ് ഡിസെക്ഷൻ ഒക്കെ തുടങ്ങിയോ?
തുടങ്ങി. ഡിസെക്ഷൻ തുടങ്ങി.
ശരി, ഞങ്ങളും അതെ, ഡിസെക്ഷൻ ഒക്കെ തുടങ്ങി. ഇനി ഇവരുടെ ഫൈനൽ സെഷണൽ പ്രാക്ടിക്കൽ തുടങ്ങുമ്പോൾ കുട്ടികൾക്ക് ഫൗണ്ടേഷൻ കോഴ്സിന് വിടും.
നമ്മളതെ, നമുക്ക് നാളെ യൂണിവേഴ്സിറ്റി ഫൈനൽ സെഷനിൽ തിയറി
തുടങ്ങുന്നേ ഉള്ളൂ അല്ലേ? ഞങ്ങളുടെ ബയോകെമിസ്ട്രി തുടങ്ങി അല്ല, ബയോകെമിസ്ട്രി കഴിഞ്ഞു. നാളെ അനാറ്റമി തിയറി.
നമുക്ക് അനാറ്റമി ആണ്. പ്രാക്ടിക്കൽസ് നമ്മൾ 29 തീരും.
ഞങ്ങളും അതെ. ഓക്കെ.
Kindly note that it's chess number 1 that shall be starting the presentation. Chess number 1. Chess number 1. Can you follow?
Maithili, is this chess number 1?
That's right, ma'am. Chess number 1.
Okay.
Chess number 1, please switch on your mic. Can you follow?
Yes, I can hear.
Okay, so I'll just introduce the rules briefly. You'll be getting 12 minutes for your presentation, and I'll be posting a warning signal, post 10 minutes, and then you'll have the Q&A session for 3 minutes. Is that okay?
Okay.
Then you may start the presentation.
Good evening, ma'am.
Good evening.
My name is Shubham Maheshwari. I'm from Pacific Medical College and Hospital, Udaipur. Today, I'm going to present you the topic nasal septum. So, what is nasal septum? Nasal septum is a median line, is a median
Mr. Shubham,
septum.
excuse me, please share your PPT.
Okay.
Sorry for the interruption.
Uh, from where I would share my PPT? Excuse me.
Shubham, can you share the PPT on the Meet?
I don't know how to share. There is no option of sharing the
Uh,
PPT.
Oh,
I see. I shall let you know the instructions soon.
moderators,
But you may start the event.
please give instructions to the candidates to how to open the PPT and share screen. While we are waiting for this, you
Yes, ma'am.
contact all the candidates and give them instructions. Make a trial also so that we will not lose time.
All right, ma'am. Mr. Shubham, there's three dots on the lower right side of the screen. Can you see that?
Yes.
There's an option share screen that comes onto it. Please click that and you can connect it to the PPT and present it that way.
Actually, there is no option in start.
That'll be share screen, a box with an arrow facing upwards.
No, I'm not able to share.
Yes, it's working.
So now, what I should do next? How to add?
Please open the file where your PPT is being shown,
Okay.
and that'll appear on your screen, and we can see it too.
I have opened that file, what I've sent on the WhatsApp to you, but it's not on my screen.
Yeah,
It is appearing to us. It's appearing on the screen. Yes.
we can see it, Shubham. Mr. Shubham, we can see it.
Okay, ma'am.
You please
You may begin.
start your presentation.
Okay.
Thank you, ma'am.
So, ma'am, I'm gonna tell you about the nasal septum. Nasal septum is a median septum. It is made up of osteocartilaginous partition, which means it is made up of both bones and cartilage. It is divided. It divides the nasal cavity into two halves, and it is asymmetrical. The bone part is the main bone part is uh, perpendicular palate of ethmoid, vomer, and then accessories bones like uh, spine of frontal bone, nasal crest bone, palatine bone, maxillary bone, and the cartilaginous part which is formed is septal cartilage and inferior nasal cartilage, alar cartilage. Then there is a cuticular part which is a fibrofatty tissue which covers the skin, and then there is a lower margin called columella. You can see it in this diagram. This is a perpendicular palate of ethmoid, the main bone, and vomer. This is septal cartilage, and here is so we should come on arterial supply of the bone. of the nasal septum. Nasal, if we can imagine nasal septum, if we divide into four quadrants: anterior superior, anterior inferior, posterior superior, and posterior inferior. The posterior, the anterior superior is supplied by anterior and posterior ethmoidal arteries, which is a branch of ophthalmic artery, and which is a branch of internal carotid artery. The anterior inferior part is supplied by superior labial artery, which is a branch of facial artery, and posterior superior part is supplied by sphenopalatine artery. It is the main artery of nasal septum, and it is a branch of maxillary artery. And posterior inferior artery is the branch. Posterior inferior artery is supplied by greater palatine artery, which is also a branch of maxillary artery. And this is a branch of external carotid artery. There is a little area, or it is a there is an in interior and anterior inferior part, or it is also known as vestibule of septum. There is a common site of where the anastomosis is formed by all the above branches, and it is known as cache celebs black plexus. So we come on to the venous drainage. The venous drainage of the anterior half is drained by and facial vein, and posterior half is drained into the pterygoid venous plexus. Uh, Now we come to the nerve supply of the nasal septum. Nasal septum general the sensory nerves are the branches of trigeminal nerve, and if we again imagine four quadrants, then anterior superior is supplied by internal nasal branch of anterior ethmoidal nerve. Anterior inferior is supplied by anterior superior alveolar nerve. Posterior superior is supplied by medial posterior medial posterior superior nerve, and posterior inferior is supplied by nasopalatine nerve. These are which is all this is all branch of pterygopalatine ganglion. And there is a special sensory nerve, that is olfactory nerve, which is the first cranial nerve. It is confined in the upper part of the nasal. So now we come to the lymphatic drainage. Anterior half is drained by the submandibular nodes, and posterior half is drained into the deep cervical nodes or retropharyngeal nodes, or in. So the main clinical significance of the nasal septum is that the nasal septum may get deviated or lose its original position, but it can be due to accident, or it is by birth, in which the nasal septum is shifted towards one side, and it blocks the air passage, which becomes a unilateral air passage in the nose. And there is a nasal septal perforation, in which some pores are formed in the nasal septum, which is corrected by surgery or septoplasty. The, there is a the if in anterior inferior part of nasal septum, there is a large network or branches of all the arteries is formed, which is also known as little areas or Kisselbach's plexus. When epistaxis means bleeding from the nose, it is very common site. Anterior inferior is very common site of epistaxis, and it is a dangerous area of face, as the as blood can go to the carnivus sinus through deep cervical nodes, and it can form uh, it can damage in that area and can thank you, ma'am. I've completed my presentation.
Hello, Mr. Shubham. Can you hear me?
Yes, ma'am.
Please come to the screen. Okay. Is the nasal septum always set exactly in the midline?
No, ma'am. It is not always set exactly in the midline.
Ah.
It is in some right side of.
It can be slightly deviated to
Slightly deviated. It is a
one side,
normal.
isn't it? Is it covered by mucosa or is it bare?
It has a membranous part also, which is in which some mobile part is covered by mucosa.
You think only one part of the septum is covered by
No, no,
mucosa?
whole part is covered by mucosa,
Ah.
mucous membrane,
Hmm.
and the mobile part is also covered with mucous membrane.
Mucous membrane. The septal cartilage, what type of cartilage is the septal cartilage?
Septal cartilage is.
Which are the different types of cartilages you have seen in your histology lab?
I've seen.
Ah. One begins with the letter H. Another one begins with E.
I don't know that.
And these are basic things, Shubham. Have you completed your first year or you have just joined?
No, I'm in the first year. I've not completed it. I'm in the first year.
Just joined.
Yes, ma'am.
Okay. Then I think it is very bold of you to give your name for this competition. Okay. Very good.
I want to take an experience. It
Just to
matters
just
me a lot. If I have taken part, then it gives me more opportunity to connect with everyone, and makes me also good.
Okay, very good. I think I will give you a big applause for that. You are very bold and courageous to join this competition. Okay.
Thank you, ma'am.
So there are several things that you don't know, and you are you have just learned by heart all these things. But it is I think it's a very bold step from your part. Okay. So you will go places.
Thank you, ma'am.
Right. Dr. Sadi, would you like to put in a
Yeah,
few?
ma'am. Actually, I want to congratulate him for his boldness and what should I say, to participate in this competition wherein other seniors who have completed the first MBBS is participating. Am I right?
Yes,
Same.
yes.
But this boy is just entered the first MBBS. He should be 100% courageous to participate in such a national competition without knowing anything. He is finding it difficult to say words also, no?
Yeah,
So
yeah.
there is no point in asking any questions regarding the nasal septum. This much is more than enough. A big applause to you from my part also. No,
Yes.
no more questions. I appreciate you. It's very nice to meet you from Udaipur. We are from Kerala. Nice. Nice
Shubham,
place, Udaipur.
you will become a great doctor, Shubham.
Thank you, ma'am.
Very good, very
All
good,
the best.
excellent.
All
We
the
This
best.
really appreciate.
ma'am, it also gives me exposure that how we can connect or how we can
Yeah,
interact
yeah, yeah.
and
Yes.
sort. This gives me a very good experience.
Yes.
Nice.
So you should participate in more competitions. Okay, Shubham.
Yes, ma'am.
Yes. Good.
Thank,
Thank you.
thank you, Shubham, for that. Thank you,
Yeah.
first number two. Now, now it should be chest number 2 that shall arrive. Start the presentation.
Okay,
I
Shubham,
Shubham,
bye.
sit.
Bye. You can
bye.
leave. You can leave.
Yeah, you may exit. Shubham. Chest number 2, please switch on your mics.
Good evening, ma'am. Good evening, madams.
Good evening.
Judges, please note this is chest number 2.
Ah,
All right, chest number 2, please share your presentation.
Okay.
Chest number 2, I'll just give you a brief reminder, a gentle reminder that you'll be getting 12 minutes for your presentation, and I shall issue a warning signal after 10 minutes. Then you'll have the Q&A session for 3 minutes.
Okay.
You may begin.
Good evening, respected judges. I am Keisha from Government Medical College, Calicut, and I'll be presenting my topic, nasal septum, today. Digging right in, what is nasal septum? Nasal septum is a median osteocartilaginous partition that is going to divide the right and the left nasal cavities. On each side, it is covered by the mucous membrane and forms the medial wall of the nasal cavities. It is seldom in the midline. It's usually deviated towards left or right, but it's most commonly deviated towards the right side. Okay. So, as I said, osteocartilaginous. That means there would be a bony part and there would be a cartilaginous part. Now, the bony part is majorly formed by vomer and the perpendicular plate of ethmoid. Other than that, we have the nasal spine of frontal bone, the rostrum of sphenoid, nasal crests of nasal, palatine, and maxillary bones, which are going to form the bony part of this osteocartilaginous structure. Then coming to the cartilaginous part, we have the major part that is formed by the septal cartilage, and the remaining minor part contribution is given by the septal process of inferior nasal cartilage or the septal process of the two major alar cartilages. Now, this is the lateral view, and here we can see very clearly that the posterior superior region is accommodated by the perpendicular plate of ethmoid. And then we have at the posterior inferior region, the vomer, and between the angle, we can see the septal cartilage. The other minor bones, which we can see over here, are the spine of the frontal bone. Then we have the crest of the nasal bone, membranous septum and columella, which I'm going to discuss just now. And then anterior nasal spine of maxilla, the crest of maxilla, the crest of palatine, and the rostrum of sphenoid. Now, the membranous septum and the columella. The septal processes of the medial crura is going to come and it is going to join in the anterior, in the midline, in the front, through a fibrous tissue. That fibrous tissue connection between the two alar cartilages is the columella. Between the caudal part of the septal cartilage and this columella, we have one double-layered skin fold. That is the membranous septum. These both structures are very freely movable. Okay. Then coming to the borders and the surface of the nasal septum. Now, I made this small structure for easy understanding. Suppose this is the nasal septum. So the nasal septum, this is the anterior part and this is the posterior part. So it has an anterior border, it has a posterior border, then it will have a superior border and an inferior border, and it has a right surface and a left surface. Now coming to the arterial supply. For easy understanding, we are going to divide into 4 quadrants. Okay. So when we talk about the anterior superior part, it is supplied by the anterior ethmoidal artery and the posterior ethmoidal artery, which are both branches of the ophthalmic artery. Now, the anterior inferior part is supplied by the superior labial artery, and then we have the posterior inferior part, which is supplied by the greater palatine artery, and then we have finally the posterior superior part, which is supplied by a branch of sphenopalatine artery. The septal branches of all these arteries are going to supply. Now, more about these arteries. Okay, so making it easy, we have a common carotid. It is divided into external carotid and internal carotid. Now, external carotid gives a lot of branches, out of which one is the maxillary artery, and then we have the facial artery. The maxillary artery is going to give 2 branches. One is the greater palatine artery and the sphenopalatine artery. The sphenopalatine artery is the major artery which is going to supply the posterior superior part, and the septal branches of the greater palatine artery are going to supply the posterior inferior part. Now, the facial artery, branch of the facial artery is the superior labial artery, which is going to supply the anterior inferior part. Finally, the internal carotid artery, branches of thalamic artery, which is going to give anterior and posterior ethmoidal arteries, which are going to supply the anterior superior part. Now, coming to the venous drainage is through plexuses. There are a lot of venous plexuses. Now, these plexuses can be divided into anterior and posterior. So, anteriorly, these plexuses are going to drain in the facial vein, and posteriorly, they're draining in the pterygoid venous plexus. Okay. Coming to the nerve supply. Nerve supply can be divided into a general sensory nerve supply and a special sensory nerve supply. The general sensory nerve supply is majorly derived from the trigeminal nerve, that is the fifth cranial nerve. And the special sensory nerve supply is the olfactory nerve supply. So the general sensory nerve supply is via the following branches. So when we talk about the posterior superior quadrant, in the posterior superior quadrant, we have the medial posterior superior nasal branch of the pterygopalatine ganglion. Then when we come to the anterior superior part, we have the internal nasal branches of the anterior ethmoid nerve. Then coming to the anterior inferior part, we have we have the anterior superior areolar nerve, and then finally we have the posterior inferior quadrant, which is supplied by the nasopalatine nerve, which is one of the major nerves, and it is derived from the pterygopalatine plexus. Nerve supply, general, special sensory, then general, as I discussed, anterior superior, anterior inferior, then posterior superior, and posterior inferior. Finally, olfactory nerves are confined to the upper part where the olfactory epithelium is there. Coming to the lymphatic drainage. The drainage can be divided again into the anterior half and posterior half. The anterior half is going to drain into the submandibular nodes, whereas the posterior half is going to drain into the deep cervical nodes and the retropharyngeal nodes. Now, the clinical correlation. The most commonest clinical correlation that we can see is the deviated septum, which is also an important cause for the nasal obstruction. It is more prominently seen in males. So it could be due to varied reasons like trauma or developmental error or something. And the complications can include breathing sinusitis, headaches, and excessive snoring. The treatment is usually through submucous resection or the septoplasty. Then this is the illustration for the deviated nasal septum, and this is the rectifying method, which is the submucous resection or septoplasty, in which the cartilage is removed and rectified. Then coming to the next, that is the supratip depression of the external nose. Now, we have to remember that other than the separating of the nasal cavities into left and right, what is the other function of the nasal septum is that it is going to provide support to the dorsum of the anterior two-third of the nose. So if there is any disease over there, or if there is excessive mucous resection, that could lead to supratip depression of the external nose. Then finally, the most important clinical correlation, that is the Little's area or the Kesselbach's plexus formation, where the anastomosis happens. So it is present in the anterior inferior part. If we saw in this diagram, here we have the anterior inferior part, and the anastomosis is between all the arteries except the posterior ethmoidal artery. So septal branch of anterior ethmoidal, sphenopalatine, greater palatine, and superior labial arteries. And it is a very common site for epitaxis, that is the nosebleed. Also, the submucous venous plexus is very prominently marked. That is the end of my presentation. Thank you so much.
Hello, Kesha.
Yes, ma'am.
Your presentation was good. Your slides were also good.
Thank you.
You could have used the pointer or the cursor to show when you were explaining. You could have used the cursor to show the parts that you were explaining. I have some doubts. May I ask you a few questions?
Sure, ma'am.
To clear my doubts?
Yes, of course.
Is the nasal septum covered by mucosa?
Ma'am, the mucosa and the epithelium, the respiratory epithelium and the olfactory epithelium.
Olfactory, very good. Respiratory and olfactory epithelium. what type of epithelium is seen in the respiratory part?
Ma'am, as columnated ciliated epithelium. Simple ciliated epithelium.
Ciliated columnar. Is it ciliated columnar in the respiratory tract? What type of epithelium lines the trachea? You have completed your first year, isn't it?
Yes, ma'am.
The previous candidate just entered the first year and he has tried his best.
Ma'am, I'm not sure about that.
Not sure.
Yes.
If you examine the olfactory epithelium under microscope, what will you see? You said it is olfactory epithelium, remaining part is respiratory epithelium. What will you see in the olfactory epithelium?
I'm not sure.
Not sure. Okay. You could have mentioned the development of the nasal septum also, because you mentioned the congenital anomalies. You could have mentioned the development also, because both these things go together.
Yes, ma'am.
Yes.
Um,
Thank you, chess number 2. Thank you, ma'am, for your insights.
Time
Now we
is,
shall be bringing. Uh,
time is over.
yes, that's right, ma'am. Would you like to ask some more questions?
Excuse me, moderator. Let
Yes, ma'am.
Dr. Sadi ma'am also ask one or two questions. Please give
Definitely,
her.
ma'am.
Okay.
Please
Okay,
take your
okay.
time.
The presentation was very good, excellent. Actually, you presented the method of presentation or the mode of presentation was very attractive, actually, and it was a crisp presentation. I have one question. Can
yes.
you tell me what is BDN now?
Sorry, ma'am, I could not hear.
BDN now. What is this BDN now, and what
Uh,
has it to do with the nasal septum?
well, I revised it like half hour ago, but I forgot.
Okay. Okay, okay. All the very best. Thank you so much.
Thank
Only
you.
one question.
Thank you.
Thank you, ma'am.
Thank you, ma'am. Thank you, chess number 2. Shall we move on to the third candidate?
Yes, sure.
So it shall be chess number 3 that we join. Chess number 3. Chess number 3. Can you hear us?
Yes, ma'am. Are you able to hear me, ma'am?
Yeah, we can hear.
Yes.
Yes, ma'am. Good evening.
Chess number 3. You shall be allotted 12 minutes for your presentation. Kindly share the PPT.
Okay, ma'am. Just 1 second.
Yes.
I'm not very sure how to operate this. I guess I'm doing it right. Please tell me if you're able to see the screen.
Y- y- Yes, we are.
Yeah.
Okay.
It's
Now
visible. It's visible.
we can see.
Yes, ma'am.
You may start.
Yes. So, good evening to one and all present here. I'm Roshni and I'm from Madras Medical College. And today we'll be dealing with the topic of nasal septum. Now, before I start, I just want to tell a simple thing. Yesterday, I got a call saying there's this topic called nasal septum and we want you to take the symposium based on it. I was like, okay, fine. Now, there are 5 of us talking about nasal septum. But before we go into that, what exactly do we mean by nasal septum? We keep repeating it, but let's take a second to first understand in basic terms what we mean. First, simple nasal, meaning something related to the nose. And second is septum, which means it's a partition. So, the whole concept is about a structure that's related to the nose. And second, it's going to function like a partition. So, what does this divide? The internal nose. So before understanding what this medial wall is or what the nasal septum is, we look at the internal nose. If we take the internal nose, first it's one big cavity. Now we put a median septum in it and we divide it into a left cavity and a right cavity. What is it called? The left nasal cavity and the right nasal cavity. Now when it's a cavity, it's going to have a floor, a roof, and a base. a medial wall and a lateral wall. Here, what is important is the medial wall for us, which is formed by the nasal septum. Now, once we understand this, the rest is easy. This, I will give a brief, simple, in a nutshell definition, which is it is a median osteocartilaginous partition. Note this osteocartilaginous here. What does it mean? It means there's a bony part and then there's a cartilaginous part. That's all. Now, this bone, what is it made up of? It has two contributions. One is ethmoid bone. What happens is from the base of the skull, you will have a perpendicular plate coming down like this. If you take from me, we have a mid-sagittal plane coming called the perpendicular plate of the ethmoid. And second, we have the vomer, which is an unpaired bone seen again in the mid-sagittal plane. So two major contributions over, which give to the bony part. What are the other minor contributions? First one would be the frontal bone, which gives a nasal spine. Second would be the nasal bones, which give crests. Then you have a separate sphenoidal crest present here. You'll be able to see all of this marked here. And then the last, we'll have a nasal crest, which is formed by both the maxillae and also the palatine. One interesting fact that I want all of you to remember here is this vomer bone is special. It gets ossified by intramembranous ossification as compared to endochondral ossification, which occurs in some other bones present here, like the ethmoid, for example. So we finish the bony part. The bony part is present posteriorly. And in the anterior part, we have the cartilage. Okay. So what is this cartilage made up of? Again, two contributions. One, major septal cartilage seen anteriorly. And then you have something known as the septal cartilage again. So you'll be able to see all over here. The septal process of the alar cartilage, which will come from both sides like this. With that, we go to the third major contribution, which is the columella. What happens is when this alar cartilage comes like this, one is coming like this, the other one comes like this. They fuse in between. And when they fuse, they do not simply fuse. They have some fibrous tissue that is going to come here and help them fuse. And that fibrous part is the columella. On either side, we will have skin. So if I'm going to look inside, I will see skin there, and interior to the skin will be the columella. And last, I want you to see this part. This is the next contribution. The membranous septum. How is this membranous septum formed? Simple, just by skin. There is no cartilaginous part. There is no bone also. So what do we understand from here? If there is just skin, it means it will be highly flexible. And when it is flexible, it means it will easily move. That is why the front part will easily move. But the posterior parts that are made of cartilage, that is thick cartilage and bone, will not move. So if I have to simply state what we have covered so far, I simply said we have the columella, then we have the membranous septum, then we have the cartilage, and finally we have the bone. We understand this? The structural part is over. What is this covered of? The submucosa and the mucosa. This is the important part. The submucosa is going to have a lot of blood vessels seen. And how are they going to be? They're going to be thin-walled. Remember this. And finally, after the submucosa, we have the mucosa, which is nothing but the lining epithelium. Now, based on the nose, where we look inside the nose, we will be able to see different mucosa present. If I have to take the nasal septum, in the anterior part, what will I see? I will see keratinized, stratified, squamous epithelium. Why? Because here we have the skin. This is going to extend inside. It will not abruptly end. It will go for a little distance, form the keratinized, stratified, squamous epithelium, and then slowly, when we go posteriorly, it will change into respiratory epithelium, which is nothing but our pseudostratified, ciliated, columnar epithelium. But one thing, we keep saying, I smell something. How do we do it? With our nose. I haven't mentioned any sensory component here at all, which is specialized for nose, which is specialized for smelling. And that is essentially the olfactory epithelium, which we will see in the superior 1/3. So 3 types we see. Keratinized, then after that we see pseudostratified, and then on top we will see olfactory epithelium. With this, we cover the basic structure. Finally, one additional point that I want to give here is the vomeronasal organ. also known as the Jacobson's organ. In humans, it is not that important. It is just a rudimentary structure present. Again, where is it present? In the antero-inferior part, in the 1/3, in the antero-inferior 1/3. It is rudimentary. We have not found any role yet. But if you take lower animals, there is one role where people say the pheromones that are being secreted, that is found using this vomeronasal organ. They're able to go based on chemical signaling. With that, we finish the soft tissue landmarks. Now, I've told you so many parts. I've told the vomeronasal organ. I've told about cartilage. I've told about a lot of bone present. They're all going to be hungry. They all want to eat too. So how do they eat? Using the arterial supply. And here, there are just 5 simple arteries that will contribute. What are they? We have the anterior ethmoidal artery, the posterior ethmoidal artery, the sphenopalatine, the superior labial, and then the greater palatine. One thing that we have to remember, 4 out of 5, that is excluding the posterior ethmoidal artery present here, all of them come to the anterior part, antero-inferior part. And they form what? They form a network. And I can call a network a plexus. And there's a specific name for this plexus called the Kesselbach's plexus. Obviously, if I'm telling you, there is some functional importance. What is it? Simple. We've seen small children walking around, playing. They keep picking their nose all the time. So what happens? They do not keep cutting their nails often. So by mistake, when they touch this plexus or when they cause some sort of harm to this plexus, it starts bleeding. Or in other words, there is epistaxis. So the most common reason that we see in young children is due to rupturing or is due to some sort of harm to this Kesselbach's plexus. One additional point is this blue thing that I've marked here, it is not present on the medial wall. On the lateral wall, in a similar position, you will be able to see the Woodruff's plexus. Now, why have I marked this in blue? Because it's the venous blood that will come out if there is a posterior reason for an epistaxis present. It's just an additional point. One last thing is the Kesselbach's plexus. Apart from being functionally important for this epistaxis, it could also be one place where you see a higher incidence of hemangiomas or bleeding polyposis occurring. So with that, we finish the arterial supply. Now, I've given food, the arterial supply is done, the blood has to go back. So how does it go back? By the venous return or the venous drainage. And the venous drainage is quite simple. All the veins correspond to the arteries. The only thing is, where does this vein further drain into? You take the antero-inferior parts, it goes to the facial vein. You take the posterior parts, it goes to the infratemporal fossa. And the superior parts, that will go either through the foramen cecum and drain there, or it will go through the cavernous sinus. Simple. Now, I've told arterial and the venous drainage. We've left one more thing in the same series. Yes, lymphatics. We can divide the nose broadly into the anterior part and the posterior part. The anterior goes to the submandibular group and the posterior part goes to the retropharyngeal group of lymph nodes. Let's go back to the example where I say I'm going to give you Maggie now. The first thing you notice is the smell. So,
sorry for the interruption. Just a minute, you have 2 minutes left.
I'm sorry,
You have
ma'am.
2 minutes left. 2 minutes left. Okay.
The nerve supply, I can broadly divide it into the olfactory part, the general sensory part, and the autonomic part. So this olfactory part is due to olfactory nerve, which is the first cranial nerve. Second, we have the nerve supply, which could be due to the anterior ethmoidal nerve. Then the internal nasal branch of the anterior ethmoidal nerve. Then we have nasopalatine nerves and the greater and lesser palatine nerves. The autonomic, sympathetic and parasympathetic is governed by the pterygopalatine ganglion. Now, all this is over. We'll go to the applied anatomy. First, we see a person walking and they suddenly fall down on their face. We say their nose got broken. What do we mean? We mean that person had a septal fracture. It could be because the person fell down and got hurt anteriorly or in some cases inferiorly as well. Second, a deviated nasal septum. Why does this matter? It's a median septum. Let it go straight. Let it go a little sideways. Because it could cause turbulence to the air that's coming in, which is a reason for nasal obstruction of air. Why does it occur? Maybe due to trauma. Again, a person falls down to the side and gets hurt, or there could be a developmental error as well. So we'll see the simple development and then the associated effects. Simple development is there is a tictospinal process coming downwards, and then you have the palate going upwards. When both are in equal growth, that's not an issue. But when there's an unequal growth, that's when you will see buckling of the lesser strong structure. Here, in this case, this will be the nasal septum that is going to get buckled. Or even in the case of mouth breathers, adenoid hypertrophy in children who keep getting recurrent cold, you will see. Or in some cases of cleft lip and cleft palate, or with developmental dental abnormalities as well. So what do we do to correct this? We use something known as septoplasty. It's a very conservative approach where we try to rearrange everything. We just cut everything and we place it properly in a straight line. It is repositioned. The only thing is the very, very bad parts which cannot be salvaged are removed. And it's corrected using plastic means. And last, we have seen epistaxis in the littles area. When this gets worse, it forms something known as a hematoma. If it gets infected, it leads to abscesses which have to be drained and antibiotics have to be administered. And last, in worse conditions, when this abscess is also not able to be treated properly, it could lead to perforations, which are a little serious conditions. With that, I end. Thank you so much for giving me this wonderful opportunity. Mom.
Yes. Roshni?
Yes, Mom. Can I stop sharing the screen, Mom?
You are in which year now? First
Mom,
year?
I'm in the first year now, Mom.
Which semester?
Mom, the very first one, I guess. I have to write my exams in Jan or Feb, Mom.
Okay. So you have completed the first MBBS, isn't it? 2 semesters. So
Yes,
it was a wonderful presentation. You are going to be a great teacher as well as a doctor in the future. So you have made the subject very simple, easy to understand. The slides were also very good. Okay.
Yes,
only thing is your time management. You could have presented several times before presenting in this, so that you could have managed the time also. At first, you were very slow. Then you had to rush up in the end. Okay. That was the only minus point that I could find. No problem. You have covered almost everything. Can I ask you a few questions?
Yes, Mom. I'll try my best to answer, Mom.
Yeah, that is why I am sitting here.
Yes, Mom.
To listen to and see your presentation and also to clarify certain doubts.
Yes, Mom.
What is meant by epistaxis digitorum?
Mom, epistaxis digitorum.
Yeah.
I'm not sure, Mom.
You have explained it. You have mentioned it.
Yes, Mom, but I'm guessing it's because of when children or someone keeps picking their nose due to use of fingers, there is some cause of epistaxis.
Correct. That it is given in the surgery textbook, Bailey and Love. Okay. Digit means finger. Epistaxis means bleeding from nose.
Yes,
So just by picking the nose, nowadays, especially girls, they are growing the nails, isn't it? Long nails. So by picking the nose, they can irritate the capillaries and that can lead to bleeding. So this is called epistaxis digitorum. You have explained it. Only thing is you haven't given a name to that.
Yes,
you mentioned a foramen cecum. A vein can enter the cranial cavity through the foramen cecum. What is foramen cecum?
Mom, the typical meaning would be foramen is any opening and a cecum is some blind opening, Mom, and blind pouch. So from the nose, it is seen in the anterior cranial cavity, in the anterior part.
Where exactly? Can you pinpoint the site?
Mom, in front of the crista galli, Mom.
Anterior to crista galli. Okay, very good. Anterior to crista galli. So it is seen in which bone? In which bone do you find a crista galli?
Mom, I'm guessing it's ethmoidal bone, Mom.
Correct. Your guess is correct.
Yes.
Perpendicular plate of ethmoid is it's a part of ethmoid, isn't it? Crista galli is situated just above that. And lying in front is the foramen cecum. Cecum means a blind pouch.
Yes, Mom.
So will the foramen cecum open always?
Usually emissary veins pass, Mom. So in some people it may not open always,
Yeah, it
Mom.
may not open. So it is an unusual path for the veins. Only
Yes.
in few people this path will be opened. So through the cribriform plate of ethmoid or through the anterior ethmoidal foramina or through the posterior ethmoidal foramen that the veins are entering the cranial cavity. Foramen cecum is not always patent. That is why it is called foramen cecum. Okay.
Okay.
Then suppose you take a microscopic section or a section from the olfactory region. What do you see under microscope?
Mom, I will first be able to see bipolar neurons, Mom.
Very good. Bipolar neurons.
Then
So where do the central processes of these bipolar neurons end?
they end into the olfactory bulb, Mom.
Where is the olfactory bulb situated?
It is present in the anterior cranial fossa, Mom.
Anterior cranial fossa, just above the cribriform plate of ethmoid.
Plate.
How many olfactory neurons are there? Any guess? Are they thousands, 10,000s, lakhs, millions?
Millions, Mom.
Millions. Very good. You are a millionaire. Very good. What will happen as the age advances? To these
As the age advances, actually bipolar neurons in the olfactory epithelium are one of the very few neurons that actually regenerate, Mom, or new ones are formed. Any other part of the neurons that you see, they do not again form new neurons. This is the only one that forms. But as age advances, the rate at which they replicate is going to reduce, Mom. So, and they lose their sensitivity also slowly due to the lack of receptors or the loss of functional receptors. Thereby, the person will not be able to distinguish between a lot of smells.
Okay. So, what is the common complaint from old people, grandparents?
They will not be able to smell a lot, Mom. There'll be a case of hyposmia present.
Yeah, very good, very good. What is the commonest cause for hyposmia?
I'm not sure.
In you, in me.
From cold, Mom.
Yeah, very good. Common cold or rhinitis. That is the commonest cause. Okay.
Yes.
So you should not think about tumors and all when a person complains. And recently there was a viral infection all over the world. What was the complaint of the patients?
Anosmia, lot of sensation.
Yes. Anosmia was a very common complaint in COVID infection, isn't it? Now, I will ask one or two questions. Can you name a chronic infection in which perforation of the nasal septum is very common? A chronic infection. Now, the incidence of this infection is coming down drastically because of the effective management all over the world.
Mom, is it sinusitis, Mom? Chronic maxillary sinusitis?
No. I said it is a chronic infection which requires a long-term treatment.
TB, Mom?
No.
TB
Think about another one. TB, you are very close to it. I will give you a clue.
Yes, Mom.
Mother Teresa.
Leprosy, Mom.
Very good. You should not say the word leprosy. What is the medical term for that? I will give you a short form. HD.
I'm not sure, Mom.
Okay, it's called Hansen's disease.
Okay, ma'am. Hansen, because Hansen is the person who found the Mycobacterium leprae.
Oh, correct. So, leprosy, the word leprosy carries a social taboo, isn't it? Suppose in a crowded OP, if you utter the word leprosy, this patient is having leprosy, what will the other patients do? They will immediately move away from this patient, isn't it?
Yes,
So
ma'am.
it is not so contagious as a common cold. Common cold is more contagious, whereas Hansen's disease will spread only by chronic exposure. So Hansen's disease is a very common disease which can cause a depression of the nasal bridge due to perforation of the nasal cartilage. What is frontonasal process? What is its role in the development of nasal septum?
Ma'am, when the face is developing, ma'am,
Ah,
we see the stomodium first.
ah,
Around the stomodium, we'll be able to see 5 processes, ma'am, when embryological development is seen.
very good.
Frontonasal process superiorly. Then on the sides, a little laterally, we'll be able to see the maxillary processes. And then below that, we see the mandibular processes. So we have
Good.
5. This frontonasal process will form the frontal bone. Then it will extend down as the nose, the nasal bridge. Then it will also form the philtrum. So
Yeah.
this is the frontonasal process.
Doesn't it give any contribution to the nasal septum?
Ma'am, it gives
You mentioned a word tectoseptal.
tectoseptal process of this frontonasal prominence will lead to the formation of the bony part.
Actually, actually, it is also a part of the frontonasal process. So, if there is any malformation, any defect in the formation of frontonasal process, the nasal septum, as well as the palate, all
Yes,
these
ma'am.
things will be affected. Development of all these things. Okay. Now, you gave a wonderful presentation. You answered all my questions. I think you are one of the distinction students of your batch. Are
Ma'am,
you?
I hope it happens, ma'am. I really hope it happens.
Okay. Excellent. Very good student. You are a very good student and you are a very good teacher also.
Thank
I
you.
liked you very much.
Thank you so much, ma'am. It's a
Okay.
privilege.
Now, Dr. Sadi will ask you a few questions.
Eh,
Thank you,
No
Roshni,
questions,
for
ma'am.
joining.
No questions, ma'am. Roshni, you are a wonderful teacher. A
Thank you so
very gift to the medical fraternity. You will be remembered in your students, for the future students. We are such a wonderful student, well narrated, well begun, well summarized. The points were stressed by you repeatedly, and all the points you have covered in a very short span of 12 minutes. I have no questions. A great teacher. Hats off to you. Thank you so much.
Thank you so
All the
much,
very
ma'am.
best.
It
Excellent.
really means a lot. Thank you, ma'am. Ma'am, can I leave the meeting
Yes,
now?
sure. But you can't leave our hearts.
Oh, ma'am, that really means so much to me. Thank you so much, ma'am.
Okay.
Thank you, ma'am.
Thank you, chess number 3. Thank you, Roshni. Now it shall be chess number 4 that's joining us.
Coordinators, please call the next student.
Yes, ma'am. Chess number 4 shall be joining us shortly.
Okay.
The selected participants, ma'am, we've chosen them after a screening process. They were asked to submit a video presentation, and that's when we chose the 5 participants. That's how we chose the 5 participants.
Okay.
Chess number 4 is joining.
Okay.
Yes, chess number 4, can you hear us? Please switch on your mics.
Yes.
Yes, you'll be getting 12 minutes for your presentation.
Okay.
And a wind up signal shall be issued 10 minutes post your start. Okay, you may start.
Good evening, warm greetings to one and all. Today I'll be presenting a seminar on the topic nasal septum. The topic will be deal under the following headings: introduction, features, arterial supply, venous drainage, nerve supply, lymphatic drainage, and clinical anatomy. First of all, when we look the nose from below, we can see that the nasal cavity is divided into two by a septum, an osteocartilaginous septum. This is called the nasal septum. So, as we said, nasal septum is an osteocartilaginous septum, and on both sides, it is covered by mucous membranes. This is a nasal septum, and it is made up of a bony part and as well as a cartilaginous part. The bony part is mainly formed by vomer and perpendicular plate of ethmoid, and the margins of perpendicular plate of ethmoid receives contributions from cribriform plate of ethmoid, nasal spine of frontal bone, nasal crest of nasal bone, palatine bone, and maxillary bone, as well as rostrum of sphenoid. Next is the cartilaginous part. Cartilaginous part is formed by mainly formed by the septal cartilage, which is the biggest one here. Next is the septal processes of inferior nasal cartilages. Now you can see an area here. This is called columella. This is the lower end of the nasal septum. This is the cuticular part. It contains fibrofatty tissue and it is covered by skin. This is columella. Next, moving on to the arterial supply of nasal septum. The 4 parts of the nasal septum are supplied by different arteries. The anterosuperior part is supplied by, as you can see, the posterior ethmoidal artery and anterior ethmoidal artery. And these are the branches of ophthalmic artery. Next is the arterial supply of anteroinferior part. Anteroinferior part is supplied by superior labial artery, and this is a branch of facial artery. The posterior part is supplied by splenopalatine artery, and this is the main artery that is supplying the nasal septum. This is a branch from maxillary artery. Next is the posterior inferior part. This is supplied by greater palatine artery, as you can see here, and this is the branch of maxillary artery. And there is a clinically significant area present in the nasal septum that is called Little's area. And Little's area is seen somewhat here. And let's see what Little's area is. So in the andro-inferior part of the nasal septum, you can see anastomosis of various arteries supplying the nasal septum. And that is the anastomosis of anterior ethmoidal, superior labial, greater palatine, and spinopalatine. These anastomoses to form a large capillary network known as Kieselbach's plexus. And this area, which is a common site of nasal bleeding, nasal bleeding is also known as epistaxis. The common site of epistaxis, that is Little's area. It is seen in the andro-inferior part of the nasal septum. Next is venous drainage of nasal septum. Various veins form plexus, which is more marked in the Little's area, and it is drained anteriorly into facial vein and posteriorly into pterygoid venous plexus through sphenopalatine vein. Next is the nerve supply. First of all, we are talking about the distribution of general sensory nerves in the nasal septum. General sensory nerves arise from trigeminal nerve, and it is distributed to the whole of the septum. In the andro-superior part, the nerve supply is by internal nasal branch of anterior ethmoidal nerve, as you can see here. Next is the nerve supply of andro-inferior part. It is by anterior superior alveolar nerve. Next is the nerve supply of posterior-superior part. It is supplied by medial posterior superior nasal branches of pterygopalatine ganglion. Then posterior-inferior part, it is supplied by nasopalatine branch of pterygopalatine ganglion, and this is the main supply of the nasal septum, that is a nasopalatine branch of pterygopalatine ganglion. So since we finished the distribution of general sensory nerves, now we are moving on to the distribution of special sensory nerve. The special sensory function of nasal septum is olfaction, and thus olfactory nerves are present in nasal septum, and they are confined to the upper part of nasal septum, and this area is called olfactory area. Next, moving on to the lymphatic drainage of nasal septum. The anterior half drains into submandibular nodes, and the posterior half drains into retropharyngeal and deep cervical nodes. Moving on to the clinical anatomy of related to nasal septum. First is epistaxis. Epistaxis is nasal bleeding. It is another name for nasal bleeding. And the main artery responsible for epistaxis is sphenopalatine artery. And Little's area is the most common site of bleeding in nose. Next is deviated nasal septum or DNS. You can see a deviated nasal septum here in comparison to the normal nasal septum. And this is not an uncommon condition, and this is a very important cause of nasal obstruction. This is mainly seen in males compared to females, and it occurs due to various factors like trauma or congenital abnormalities. If DNS is severe, as in DNS causing mechanical obstruction, it may lead to difficulty in breathing, sinusitis, headache, excessive snoring, etc. So if DNS is as severe as that, it can be corrected by submucous resection or septoplasty. So nasal septum, the function of nasal septum is not just separating the nasal cavity into two. It also provides support to the dorsum of nose. So if there is any destruction to the nasal septum, it may either due to some disease or excessive removal of submucous resection, excess removal in submucous resection, it will lead to supratip depression of the external tip. You can see the supratip depression here. So by this, I'm concluding my presentation. Thank you.
Will you please introduce yourselves?
Ma'am, I'm Nayana from Calicut Medical College.
Which year? Which batch?
65th batch, ma'am.
65th batch. Okay. Naina, your presentation was good. Your slides were also good. Can you add one or two sentences, a few words about the development of nasal septum?
Development is from frontonasal process.
Frontonasal process. So a growth comes from the frontonasal process and it will fuse with the developing palate, isn't it? Are any branches from internal carotid artery supplying the nasal septum? Any
Yes, ma'am.
branches? Which branch?
Internal carotid artery, ophthalmic branch of ophthalmic artery supplies. It gives rise to the.
Which are the branches from ophthalmic artery?
Ethmoidal, anterior and posterior.
Anterior and posterior ethmoidal arteries.
arteries.
Do both these arteries take part in the formation of Kieselbach's plexus?
No, ma'am. Posterior ethmoidal artery doesn't take part, but anterior ethmoidal artery does take part in the anastomosis.
Okay. What type of neurons do you find in the olfactory epithelium?
Bipolar neurons.
Bipolar neurons. Where do the axons of these neurons terminate?
Olfactory epithelium.
Olfactory epithelium is situated in the nasal mucosa, upper one-third of nasal mucosa, both on the nasal septum as well as lateral wall of nasal cavity. The axons of these neurons pass through dash.
Pass through
basal cells. There is a bone with the numerous foramina.
I don't know.
You should know. In the anterior cranial fossa, forming the base of the anterior cranial fossa.
Ethmoidal bone.
What do you call that region?
Cribriform plate.
Correct. Cribriform plate of ethmoid. How many olfactory nerves are there?
No, more than two.
More than two, because I asked this question, isn't it?
Yes, ma'am.
How many olfactory neurons are there? Thousands, 10,000s, lakhs, millions?
I'm not sure, ma'am.
Not sure. Have a guess.
Thousands.
Thousands. Okay. There are millions of neurons, and the axons of these neurons form about 13 to 20 bundles on each side. Okay, 13 to 20 bundles. Chule kandittundo, chule. It is just like that. Chule, it is made of irkils, and they are tightly bound by a string. Just like that, all these axons, they form 13 to 20 bundles. But functionally, for the sake of explanation, we consider olfactory nerve as one on each side. Actually, there are 13 to 20 olfactory nerves on each side, and they pass through the cribriform plate of ethmoid. Where do they end?
The olfactory bulb.
Olfactory bulb, from which the olfactory pathway starts, isn't it? Okay, then can you name a chronic infection that can produce damage to the nasal septum? A chronic infection. Chronic means one which runs for several months or even years. An infection.
Rhinitis.
Rhinitis is ഇപ്പൊ വേണമെങ്കിൽ തുടങ്ങാം ഒരു rhinitis അല്ലേ? It is an acute condition. maybe viral, bacterial. I am asking about a chronic infection.
Chronic infection.
Which lasts for several years. It can cause several deformities in the body also, not only the nervous system. I am giving these clues because you are a first year student. അതുകൊണ്ട് പറയുന്നതാണ്.
I can't think of anything right now.
Okay, it is Hansen's disease or leprosy, right? In which you can see a saddle nose deformity because the nasal septum is destroyed by the infection. Um, Now, Dr. Sadi ma'am will give her comments. Thank you,
Okay.
Naina, for joining us.
Thank you, ma'am.
Thank you so much for the wonderful presentation. I have one doubt. What do you call the covering of the nasal septum, the bony part and the cartilaginous part? Are they different? Covering.
Actually, the answer is in that question itself. Mucosa covering the bony part and
Yes.
mucosa covering the cartilaginous part. Sadi
Yes.
ma'am has given you a clue.
One is bony part, muco.
What is the covering of the bone called?
Osteum.
Which
Periosteum.
Mucoperiosteum. Then the cartilaginous part is covered by
Mucoperichondrium.
It's called mucoperichondrium. Mucoperichondrium.
Columella, what is the difference? What do you get in columella? The fibrofatty
Is
tissue is
covered
covered
by
by
skin.
skin, yes.
Skin.
Okay, thank you. Our time is allotted time is over.
All right.
Thank you,
Okay.
nice. All the
Thank you, Naina. Bye.
Thank you, ma'am.
Thank you, chess number 4. Thank you, ma'am. Now it shall be chess number 5 that's going to join the meeting. Chess number 5. Kindly show your presentation. Share your presentation with me. Yeah. Yes. You shall be getting 12 minutes, and I shall warn you as soon as 10 minutes are over. You may start.
Yeah, 1 second. Is my screen visible?
Yes.
Good evening, ma'am. Myself, Amisha Jain. Here is my presentation on nasal septum. The nose is divided into external nose and the nasal cavity. The nasal cavity is divided into left and right by the nasal septum. So here is the anatomy of the nasal septum. The nasal septum is made up of bone and cartilage. The bony part is made up by the perpendicular plate of the ethmoid, the vomer, and the cartilaginous part is mainly made up by the septal cartilage. The bony part also includes the nasal spine of frontal bone and the crest of maxilla, the crest of palatine bone, and the crest of the nasal bone. The cartilaginous part also includes the inferior nasal cartilage, which is the membranous septum and the columnar septum. The lower part of the nasal septum is the columella. The nasal septum has 4 borders, that is the anterior, posterior, superior, and inferior. It has 2 surfaces, that is the right and the left surface. Now comes the blood supply of the nasal septum. The arterial supply of the nasal septum is mainly by the 5 arteries, that is the superior labial artery, the sphenopalatine artery, the greater palatine artery, the anterior and posterior ethmoid arteries. The anterior superior anterosuperior surface is supplied by the posterior ethmoid artery and the anterior ethmoid artery. The anterior inferior surface is supplied by the superior labial branch. The posterior superior surface is supplied by the sphenopalatine artery, and the posterior inferior surface is supplied by the greater palatine artery. The venous drainage is in the little's area and it forms a plexus, and the anterior surface drains in anterior venous drainage is into the facial vein, and the posterior venous drainage into the pterygoid venous plexus. The nervous supplies of the nasal septum is as follow. The anterior superior supply is by the anterior ethmoidal nerve. The anterior inferior supply is by the anterior superior alveolar nerve, and the posterior superior supply is by the medial posterior superior nasal branch of the pterygopalatine nerve plexus, and the posterior inferior nerve supply is by the nasopalatine branch. Now comes the clinical correlation of the nerves of the nasal septum. It includes the epistaxis, and it is main cause of it is the sphenopalatine artery. Then there is DNS, that is the deviated nasal septum, septal hematoma, septal fracture, septal perforation. Thank you.
Hello, Amisha.
Hello, ma'am.
What is the spelling of septal?
SEPTAL.
Can you share that slide once again? The first and second slides.
Yes, ma'am.
Share the slides once again. Nasal septum. Okay. Look at your slide.
Yes, ma'am.
Sorry,
ma'am.
Look at the slide. Now, next slide also.
Yes, ma'am.
Next slide also.
It's the blood supply.
No. After the first slide, I want to see.
First slide.
This is
second
first slide.
slide.
Second slide. There was one more slide in which you repeated the same spelling. Okay. Anyway, you should be very careful when you are presenting using this media. Okay, using this medium, you should be very careful. Especially the spelling is very important. So you have gained a minus mark over there. What is the development of nasal septum?
It like you want to ask from intrauterine life?
Yeah, development means that.
I'm sorry, ma'am, I don't know.
Okay. What is the lining epithelium or mucosa covering the nasal septum known as?
The mucocytes.
Okay, you can try. Don't worry.
I know about the nose. It's the olfactory and
I don't know. Excuse me. You have just joined first MBBS or you have completed first MBBS?
Ma'am, just joined.
Just joined.
Yes, ma'am.
In this NEET admission.
Yes, ma'am.
How many days old are you now in first MBBS?
10 days, ma'am.
Only 10 days. Even then, you did a good job. So there is no point in asking more
Right.
questions to
That's
a
Uh,
first year student.
Mm.
Anyway, I give you a big hand for attempting in a national competition like this. Amisha, you have a long way to go. Okay.
yes, ma'am.
Very nice. Nice of you to present.
Thank you,
So
ma'am.
I won't bother you with more questions because there is no point in asking more questions. Okay, well done, Amisha.
Thank you, ma'am.
Sati ma'am will talk.
Amisha Poi.
Poyo. Any more candidates, coordinators?
No, ma'am, that's all.
That's
Okay.
all.
We can conclude now, madam.
Yes.
So myself and Sati ma'am will talk and discuss about this, and we will let you know the marks. I will contact the college union chairman in about 15 minutes time. Is that okay? Coordinators? Harita?
That's okay, ma'am. That's okay. Thank you so much, ma'am, for your time.
അപ്പോൾ ഞാനും myself and Sati ma'am we will discuss about the performance of the candidates, and we will get back to you, not in this medium.
All right, ma'am.
I will contact the
Yes,
college
ma'am.
union chairman or Harita directly and give you the results of this competition. So both of us take this opportunity
All right.
to thank the organizers for inviting us as the judges and for conducting
Thank you so much, ma'am.
national level competition like this. Thank you
I
very
have one
much.
more, madam. I have one more
Parayyu.
sentence to tell the coordinators that this session was excellently organized, and all the performers were very well performed. All of them performed very well. Then I thank Asha madam for giving me the chance to participate in this.
Oh, it is not Asha madam, it is the college union.
Okay, no, Asha madam only suggested my name. You could have suggested any other name, no? So you gave me the chance to participate and become the part of this wonderful event, academic event.
It was a
Thank
nice
you so much.
experience അല്ലേ
Asha
സതി?
madam, college union.
നല്ല
Yes.
എക്സ്പീരിയൻസ് ആയിരുന്നു അല്ലേ?
Yes, madam.
നമുക്കും നല്ലൊരു
അതെ.
പ്ലാറ്റ്ഫോം കിട്ടി.
I never knew that it was a national level competition. I thought it is a competition wherein the participants are from inside Kerala only. Anyway, it was.
ഇപ്പൊ എവിടെ നിന്നൊക്കെ വന്നു അല്ലേ? ചെന്നൈയിൽ നിന്ന് വന്നു, രാജസ്ഥാനിൽ നിന്ന് വന്നു. നല്ലൊരു എക്സ്പീരിയൻസ്
Special
ആയിരുന്നു.
thanks to Wafa, Harida, and this girl, moderating girl.
Thank you, ma'am. Thank you, ma'am.
Okay, ma'am. Thank you.
Okay,
Thank you so much, ma'am.
Okay.
Okay, bye.
Bye.